How might we reduce teen pregnancy in Latin America? My name is Andres Marquez-Lara. I'm founder and passion catalyst at Promethean Community, and I'm here to tell you how our initiative HEAL can help with that. HEAL stands for Health, Education, Arts-Based Labs, and we're hoping to pilot this initiative in Panama as a way to test a model for the entire region. In Panama, 1 in 5 births are from women under 19, and out of those teen mothers, about 80% of them end up dropping out of school, making it harder for them to gain full-time employment and thus perpetuating a cycle of poverty. Let's imagine for a second a young teenage couple like Paola and Juan. They've been dating for a while and they're thinking about having sex. And like 75% of youth, they live in unstable homes. So who can they talk to? Well, the school is not an option since the government has prohibited for these types of sexual health education classes. And clinics are also very difficult given the high level of stigma associated with premarital sex in a predominantly Catholic country. It's not surprising that a year later, Paola ends up getting pregnant and soon after drops out of school. There are programs in Panama that are trying to address teen pregnancy, but there isn't an umbrella organization or entity that helps collaborating organizations coordinate. And with the lack of communication and coordination, silos begin to emerge. Silos that make it hard to create innovative, system-wide solutions to teen pregnancy. That's where Promethean Community's HEAL-Panama comes in. We work with the existing stakeholders and we bring them together as a way to help them build trust and improve communication. This allows them to experience each other in new ways and think differently about their work, which leads to then more coordinated efforts to create system-wide innovative solutions to teen pregnancy. And we do this with the help of local facilitators and local artists. When you bring people together and have them create art as a way to share their stories, their projects, what they're doing, they're able to begin to see each other in new ways, which builds trust. They're able to hear new things and hear each other differently, which builds and improves communication. And they're able to do things differently, which also promotes collaboration. So when you have trust, communication, and collaboration, you have key ingredients for innovation. When you are creating art with others, you're also participating in an educational experience that stays with you a lot longer than a flyer or a PowerPoint. And thus, we work with local artists in 2 ways. One is to help us break down the silos that are all too common in public health. And 2, to help create art-based interventions. Let's imagine for a second that we had a local musician, a nurse, and a teacher that wanted to work with a group of youth in Panama. And for their art-based intervention, they wanted to do a songwriting workshop where they created songs like the Condom Song. Imagine if Paola and Juan had had the opportunity to participate in such workshop. Perhaps they could have prevented that unwanted pregnancy. What's innovative about our approach is that we're bringing together elements of successful evidence-based practices from around the world. We're bringing together art-based interventions from like the ones that are being used by UNESCO to reduce HIV rates in Africa. We're bringing together elements of collective impact, in particular the cross-sector partnership and the backbone model. And we're bringing elements from social labs, such as that of prototyping. And we're bringing all these different elements together to address teen pregnancy in Panama. In Panama, we'll be working in San Miguelito, which is a high-need area that was identified by our local stakeholders. We're going to be looking at teen pregnancy rates and school dropout rates. In addition to that, we're partnering with a systems design consulting group called Thicket, and they're going to help us visualize and analyze the relationships in the community as a way to help us identify where we could have the most impact based on the social network. They're also going to help us identify and visualize the participants' mental models of parenthood, sex, and health. And this is a way for us to assess their health literacy levels and tailor our interventions to that. We expect that within a 3-year period, we'll be able to reduce teen pregnancy rates in San Miguelito from 17% to 13%, and the school dropout rates of pregnant teens from 75% to 60%. While we are in the early development stages of HEAL-Panama, we've recruited some great local partners in government and nonprofit. We've also identified potential backbone organizations, and our Promethean Community Panama team is led by Nicole Orlak, Acumen's first Latin American Fellow. At first, we hope to fund these initiatives through philanthropic gifts and government grants, and we see a path to sustainable revenue through social impact bonds. We need your help to identify a range of partners to make this a reality. We're looking for people in Panama that will be interested in this approach. We're also looking for project advisors and mentors, and for local and international funding opportunities. With your help, we can help teens like Paola and Juan in Panama, and eventually throughout Latin America. Thank you.